right, we're back, and this time with a very special guest joining us from the United States. Now, 500,000, that is how many people have now passed away from the coronavirus in the U.S. President Biden has just addressed the nation outside the White House following this grim milestone and observed a moment of silence along with the vice president and their spouses. Now, the number of confirmed coronavirus infections in the United States now stands at over 28 million, another devastating global record. But there's still a silver lining here. Hospital admission rates have fallen for 40 straight days. The average vaccine administrations per day now stand at 1.7 million. That is twice as many as when President Biden took office. And by late May, the virus will be expected to kill around 500 Americans a day. It's still bad, but it's down from around 2,000 right now. So at this point, over more than a year since the outbreak of the pandemic, what do we know about the coronavirus and the future of this pandemic? Well, joining us is the U.S. government's top infectious disease expert, Dr. Anthony Fauci. He's just been awarded Israel's prestigious Dan David Prize for defending science. So, Doctor, congratulations. It's really a pleasure to have you on our channel today. So first of all, worldwide, we seem to be witnessing a drop in the number of coronavirus infections. What can we attribute this drop to, and are we nearing the end of this pandemic?
Well, I don't think we should declare that we're nearing the end. We certainly are seeing in most countries, in the United States for sure, and also definitely in Israel, probably to a greater extent than any place else, a rather sharp decline in the daily cases of SARS-CoV-2. One of the things we have to be careful of is in the United States, the background level of daily cases was so extraordinarily high for such a long period of time. We were having between 300,000 and up to sometimes 400,000 cases per day. We're now down to a weekly average of about 65,000, which is terrific compared to where we were, but terrible when you think in terms of what that means, 65,000 new infections a day. I think it's due to a number of things. You know, we had a big surge as we entered into the cold season, as well as the holiday seasons of Thanksgiving and Christmas and New Year's. And we reached a peak and started to turn around, which I think is the natural course of events of turning around after a large peak when the fuel that went into the peak is no longer there, like no holiday season, no people gathering. So it's starting to come down. Also, people adhering to the public health recommendations of masking and physical distancing and avoiding congregate settings. I don't think that the vaccine itself is having a major impact because we haven't had that large a percentage of people vaccinated yet. We're getting better and better as the days go by. In contrast, Israel, regarding the percentage of their population that's vaccinated, is doing an extraordinarily good job.
So we're going to talk about Israel soon, but there are many people who are still concerned about getting vaccinated because of how quickly vaccines were approved and because of the lack of data about their impact as a result of that. I mean, what do you say to them?
Well, I think, first of all, you have to determine why they're hesitant. If they're hesitant because they believe it went too fast, you need to take the time to explain, and we do a lot of outreach like that. I know I invest a lot of time in that, is that the speed, which is extraordinary, it's just unprecedented. The virus was first recognized in January of 2020, and 11 months later, we have a highly efficacious and safe vaccine going into the arms of people throughout the world, including in the United States. That speed was not sacrificing safety, nor was it sacrificing scientific integrity. It was the result of extraordinary advances in vaccine platform technology and the development of various immunogens that has taken place over a decade or more. So people think that research on this started with the recognition of SARS-CoV-2, but the foundation, the fundamentals of the research that got us to have a vaccine so quickly have really been going on for years prior to the onset of this
Right.
pandemic.
Now, how worried should the world be about coronavirus mutations? And if these vaccines don't, in fact, work against these mutations, is it still essential to get vaccinated?
Well, it is certainly absolutely essential to get vaccinated. We are in the earlier phase of the evolution of variants, and the more you suppress the replication of virus in whatever country you're in, but hopefully globally, the less chance there is of the evolution of variants. The more virus that's circulating uncontrolled throughout the world, the greater chance that you're going to get variants. We know from a few studies that the vaccines that are currently being used right now are effective, for example, against the UK variant, the 117, that the vaccines that are being used in the United States, the mRNA, and I believe that is also being used in Israel, does very well against the UK variant. What we do know from the J&J vaccine, and I think you can extrapolate that to the messenger RNA vaccine, that although these vaccines may not protect as well against symptomatic infection with the variants, particularly the South African variant, which is the one that's much more problematic right now than the UK variant.
Right.
If it doesn't protect you against symptomatic disease, it definitely does very well against severe disease leading to hospitalization and death. So even though you get a variant thus far, and things could change because there will be more variants, thus far, it looks like the vaccine can at least protect you against severe disease that might kill you.
Right.
May not protect you against getting infected or even getting some symptoms, but it certainly can go a long way in preventing you from severe disease.
Now, there's been a lot of hype around antibodies. Many have the perception that getting the coronavirus means that you're somehow safe from getting it again, and it's essentially the same thing as getting vaccinated. Would you say that that's true?
Well, it's certainly not the case with the variants, because what we have learned from the South Africa experience, in that in South Africa, if you were infected with the original, what we called wild type virus, the one that was the original strain, and you recover, and then you get exposed to the South African variant, the 351, the B1351, that you get no real protection at all against that particular variant. So previous infection may not prevent you from getting reinfected if the variant is different enough from the virus that originally infected you.
All right, that's good to know. Now, one of the issues that has caused a lot of concern worldwide is pregnancy. Here in Israel, we just had a case where a 32-year-old pregnant woman died from the virus along with her fetus. Now, what precautions do pregnant women need to take, and should they get vaccinated?
Well, the actual clinical trial to look at the safety and potential efficacy in pregnant women has not been done. That will be done within the coming months here in the United States. But we do have some data that is relevant to your question, and that is, since the emergency use authorization was granted for the mRNA vaccines in the United States, there have been several thousand pregnant women who have elected to get vaccinated because they felt that the potential harm to their fetus by COVID-19 disease is far greater than any risk of the vaccine. And thus far, there have been no real red flags to be concerned about. But the formal study looking at that has not been done. But we're getting encouraging information from the women who have elected on their own to get vaccinated, even though they were pregnant.
All right, now we're going to turn back to Israel. You've characterized the Israeli vaccine distribution effort as a model for the rest of the world. What do you attribute this to? Do you think that Israel's vaccination success is perhaps attributed to its socialized healthcare system?
Yeah, I think it's a lot of factors involved. One, you have a healthcare system that is uniform, and when you want to get something done, you just say, this is the way we're going to do it, and you do it. And the citizens of Israel, the people there, are used to that. That's the way they have been, addressing their health issues for a considerable period of time. So you plug in a vaccination program and it goes very smoothly. People listen, they get vaccinated. And right now, I believe, you're way up there in the number of vaccines per 100 people is somewhere over 80, I think. It's just extraordinarily good.
So on that note, let's turn to the situation in the United States where the vaccination rollout has actually lagged behind. The Biden administration warns that it's not going to be until April that Americans beyond the priority groups will have access to vaccines and that herd immunity levels won't be reached until the summer. Why has it been so difficult to roll out vaccines in the U.S.?
It really hasn't been an issue of having a problem of rolling out. We have a major issue of the demand far outweighs the supply. So when you don't have enough vaccine, there may be some areas that are not essentially administering it as efficiently as they could. But relatively speaking, when you look at the totality of the picture in the United States, it's because we have 330 plus million people and we don't have enough vaccine for everyone now. So we're giving it in a priority way as it comes in, as the months go by, as we get to March and April and May and June. By the time we get to July, we should have 600 million doses total for 300 million people. And when we get to that point, I can assure you there will not be a big problem in getting that vaccine administered. The big issue now is that our supply does not meet the demand.
Would America's response to the COVID pandemic have been different if there had been a different president in the White House when this outbreak began?
Well, I mean, the healthcare system in the United States, as you well know, has some problems. We're trying to fix it so that we can make sure that there's uniform availability of healthcare to everyone. That was attempted with the Affordable Care Act during the Obama administration. And right now with the Biden administration, very likely will try to enhance that and perfect that. I mean, I don't want to really comment about what would have been different or not with a particular administration. That's behind us now. What we're doing is looking forward to how we can best optimize the resources and what we have to get people vaccinated and put an end to this outbreak.